to Mr. Correa.
Thank you, Mr. Chairman. Mr. Bigdoian, you talk about fraud, the GAO report. In that GAO report, is there anything there that suggests that the premium tax credit should be eliminated?
No, that is not
Nothing.
part of our work.
Okay.
We're not looking at policy or viability, sir.
Okay, and I'm gonna come back to Professor Cooper. You talked about subsidies being important to cover with healthcare, lower class, middle class. We're talking about working class families in this country who, when these premiums, tax credits expire, they will essentially be uninsured. That's really the issue here. Insurance for working class families, not about fraud, because there's a lot of fraud in a lot of areas in this government. But to go after health care for working class families, that's what we're talking about today. They're going to expire, without a doubt. I want to see each and every one of us up here what kind of phone calls we're going to get from our constituents when they end up not being able to pay for their health care in the richest country in the world with the most advanced medical technology in the world. So, Ms. Cooper, let me ask you a question. Senators are talking about health care savings plans as opposed to tax credits. How is this going to enable Americans to afford health care?
Thank you for the question, Congressman. I don't think they do. I don't think they fundamentally address three core issues. The first is it still exposes consumers to significant out-of-pocket costs. If you look at the plans people are going to enroll in, they're going to have out-of-pocket maximums for individuals at $10,000, for families around $20,000. We're not going to
Small business owners, entrepreneurs, their employees, how will this tax credit cancellation help them afford health care?
Yeah, the health savings accounts won't make getting insurance easier. We're going to see premiums for a couple making $85,000 who are 60 years old jump by $20,000. It's not going to help those people.
So let's talk about this red herring fraud. There is fraud. Are individuals insured getting rich off this fraud? Getting a subsidy in their health care? Are they using it to finance their vacations? Or are we talking about an industry with brokers that are essentially making money? 850 that were suspended. How many of those individuals actually spent time in jail or actually were able to cough up those illegally gotten gains? Anybody here tell me? How many of those folks spent a day in jail? Gave back ill-earned savings, earnings that they got fraudulently. We're talking about fraud here today, and nobody went to jail. So how serious really are we about fraud versus insuring individuals? Dead people, Social Security numbers, did those people benefit from the subsidies? Did their relatives benefit from the subsidies? Or did the brokers make a buck off the government? Which one is it? Anybody?
I mean, the insurance company and the brokers, they have every incentive to
So
benefit.
why didn't they go to jail?
There have actually been some people that have gone to jail.
So the punishment here is to punish every American that's subsidized today under the Affordable Care Act. They're the ones that are going to be punished because they're going to lose the ability to afford health care. That's what we're saying here today. I'm going to tell my colleagues here, let's see what happens January 1st next year when you start getting the phone calls from your constituents that are uninsured, lose insurance, or those hospitals that are relying on those premiums to stay open, not in the big cities, but out in the countryside. That's what this debate is really about. Fraud, let's get the DAs, attorney generals to go after these criminals. But to go after middle-class, hardworking families and take away the possibility of having health care and saying it's a broken system, if it's a broken system, I challenge my colleagues, show me something better. We're waiting for your solutions. Thank you, Mr. Chairman, and I yield.
Thank you, Mr. Correa. I'd like to submit with unanimous consent an article into the record. The press release is titled President of Insurance Brokerage Firm and CEO of Marketing Company Convicted in $233 million Affordable Care Act enrollment fraud. The American people are the victim. And this is a press release from the Department of Justice. I'd like to submit that. With that being
And
said.
Mr. Chairman, I also like to submit some articles for the record. First one by Kaiser Healthcare News. Health saving accounts backed by GOP covers fancy saunas, not insurance premiums. Number 2, Washington Post, why healthcare savings accounts aren't the fix Republicans hope for. Number 3, by Fortune magazine, Trump wants more healthcare savings, yet they can't pay for the insurance premiums. Number 4, Kaiser Foundation, fraud in the marketplace, enrollment and eligibility. 5 things to know. Number 5, keep Americans covered. Fact sheet on healthcare, and then finally, small business majority. The expiration of the ACA enhanced tax credits will devastate the small business community.
Without objection, I now recognize